You're most welcome to today's talk. It's Tuesday the 11th of May. Quite a few things going on at the moment, so we'll just see how far we get. We're going to start off with India and Nepal first of all. So getting straight on to that, now the World Health Organization have just declared this Indian variant a variant of concern. Now, this really is quite incredible. We were talking about this a month ago on this channel. We were saying flights should be stopped. Eventually, the UK government ordered it as a variant of concern and the consequences of increased protection that would have. And now, finally, on the 11th of May, the World Health Organization has got round to saying it's a global variant of concern. What they've been doing for the past month, I don't know. All I did was look at simple data in the public domain, and it was obvious that this was concerning. And it's just hard to describe why they are so behind the times, or virtually for everything, it seems. But anyway, they've arrived there now, so I think we can say better late than never. Well done, WHO, for getting there. So the India variant of concern is now officially a global variant of concern. I'll restrain my frustrations from there on. So that gives it the same status as the UK variant, South Africa variant, Brazilian variant. Basically, the variant of concern status means that it spreads more rapidly, or it could evade the immune system, things that would be concerning. And we are concerned because this Indian variant is spreading quite widely now and seems to spread quite quickly. So this is the WHO, World Health Organization, are actually agreeing it spreads more easily than other variants, as we've been saying for weeks. And they say it requires more study. Well, why do they bother making statements like that? Everything requires more study. It's an axiom of this pandemic. Everything needs more study. And yet they say it needs more study. So that we actually banned our students from saying that at the end of essays. This needs more research. Well, of course it needs more research. Anyway, that's what they said. Indian variant of concern now in more than 30 countries, and there may be some evidence of reduced neutralization with the existing vaccines and people who've had the infection. Now, I'm not being alarmist here. The vaccines that we have now are going to work against the India variant, but perhaps slightly less so than the previous variants are what is being said here. So reduced neutralization, not complete immune escape by any means at all. So the vaccination program is still critical that it goes ahead as quickly as possible. Now, moving on to India itself. So the government in India are now saying that there's links between the variant of concern and the second wave. Now, we've talked about the factors in India many times, the religious festivals, the political festivals, the overcrowding, the return to normal life, which was there over the past few months before this wave, this tsunami struck, those factors. But it now seems this variant itself is a big part of the mix, a big part of the cause of this greatly increased spread in India. So the Indian government are now saying there's links between the variant of concern and the second wave. Cases in India massively underreported. Deaths in India massively underreported. Now, I actually talked to friends in India this morning on WhatsApp, and they said, I'm afraid these stories are true. There are people queuing outside hospitals. There are people dying through lack of oxygen and basic care facilities. People are not able to access the care that they require, and this is greatly increasing death rates. There are massively increased cremations. So what I'm hearing from people on the ground in India is confirming what we're hearing in the news reports. This is a complete disaster, unfortunately, that's unfolding in India, and it's tragic and devastating to witness. It's bad enough witnessing it from here. What it must be like actually there and suffering from it is another paradigm, is another order of magnitude of suffering and difficulty. Andhra Pradesh, for example, in the news, this was a BBC report, 11 deaths overnight when an oxygen tanker failed to arrive. And this is not uncommon. And of course, the oxygen tanker was going to a hospital where people had already been admitted. Many people can't get admitted, especially in the small towns, especially in the villages. So here we see the increasing cases in India. That's the 400,000 mark. That's the 300,000 mark there. And we see it carries on increasing, and we expect it to do so for another week or two at least. This will increase, as we've been saying since we talked to Dr. Nair a few weeks ago now, in India. Likewise, deaths in India are going to carry on increasing at least up until June because of the delay effect, but we see they're increasing quite dramatically now. This is the 4,000 a day. This is the 3,000 a day. But how accurate are these official figures? Well, that's not a rhetorical question. We can actually answer that to some extent now. Now, there's been some very intrepid local journalism in India on this topic, printed in Hindi and in English in India, and reported in several Western media outlets. So 11th of April, Ahmedabad, journalists counted 69 bodies being taken out of one exit from the hospital in a 24-hour period. So one hospital, one exit, they counted 69 body bags. And this is just terrible, isn't it? The next day, 20 deaths were officially reported. So a specific example there of massive under-reporting of deaths. Same group of journalists, another report here. 16th of April, visited 21 crematorium grounds, 200 bodies they saw being cremated, and the next day, and again this was in Andhra Pradesh, Ahmedabad. I apologise to Indian viewers, I know I'm saying that long. Anyway, in this area, 200 bodies, 25 deaths. Now, the government in that area said they are not undercounting, they're following government guidelines. Now, that may or may not be true because, unfortunately, there is a lot of corruption at a lot of levels in India, which is particularly sad to see against the great heroism that we are seeing from many individuals in India at the moment. So it may or may not be according to government guidelines, but the underreporting remains. 5th of May, again, 500 deaths were witnessed, 83 were officially reported. Gujarat, the same team, report that deaths could be underreported by a factor of 10. Now, this could, well, you can do the arithmetic for yourself if you want to. You know, you're talking about, you're talking about 5 to 10 times more deaths in India than the official reported figures, for whatever reasons. Another really distressing statistic, this came from DW, Deutsche Welle. 35 to 40 bodies recovered from the Ganges in Bihar that had floated down the river from Uttar Pradesh. Now, this is not quite what it sounds. In India, in the Hindu tradition, of course, great religious significance is attached to rivers. And river burials aren't unheard of in India. But apparently in Uttar Pradesh, they normally get 1 or 2 bodies a day rather than 35 to 40 bodies a day. So there's many more. And of course, the problem is Bihar and Uttar Pradesh are very poor areas in India. And relatives simply cannot afford. It's impossible for them to afford the cremation facilities. So it's understandable, but tragic that this is happening. And authorities are recovering the bodies in Uttar Pradesh and giving them dignified cremations according to the Hindu practices. But another indication of the underreported deaths. Vaccine in India, 2.5% of the population have had 2 doses of vaccine. This is not quick enough. It is not quick enough. So the vaccines, of course, they're being rolled out as quickly as they can. It's not happening quickly enough. But even when you're vaccinated, it takes 2 to 3 weeks after the first dose to have any immunity at all. So it looks like something else is required. So what we're going to do now is look at this. I want you to check this out for yourself. These are the references for it. This is the joint statement on the widespread use of ivermectin in India for the prevention and early treatment of COVID-19. Now, if you look at these are well-argued, well-evidenced pieces of work. And this is a letter to the Indian press that they want to spread this word around in India. So it comes from the Evidence-Based Medicine Consultancy. And, of course, we've had the pleasure of talking to Dr. Tess Laurie on this channel. Frontline COVID Critical Care Alliance. And, again, we've had the pleasure of talking to Dr. Pierre Corey on this channel from these organisations. Now, when people of this calibre start making suggestions, governments and agencies are pretty foolish, to be quite honest, not to at least consider what they say. So this should be actively considered, not least by the UK government. Talking of which, this letter is agreed by the British Ivermectin Recommendation Development Panel. Again, a lot of reputable clinicians on that panel. Because, of course, this could work straight away. Now, let's go into a little detail on this. So this is about repurposing existing drugs, which are inexpensive. And, of course, we've seen Dr. Tess Lloyd put together a huge meta-analysis on this, and her data is convincing. I'll put some links to the videos where we did this. And the interview I did with Dr. Pierre Corey, also scientifically impressive and emotionally quite moving as well, actually. It connected on 2 levels. Now, there's many clinical trials that have been done on this around the world, observational studies, controlled trials, and the evidence does appear to be there. And we need to follow the evidence. Where do we follow the evidence? Wherever it leads. Now, direct quotes from their paper, from this letter. And again, do check it out for yourself and just click on the links. I always include them. Here I am. Right, ivermectin, a safe medicine which has been used for nearly 40 years to treat parasitic infections. It looks like a simple statement of fact. 3.7 billion people have been treated with ivermectin for parasitic infections, and it's found to be extremely safe. That is, a lot of people have had this drug and found it to be safe. So it's not a dangerous, toxic drug used in the right doses prescribed by people's own doctors. New evidence shows that it has potent antiviral and inflammatory properties as well as antiparasitic. So there we go. There's evidence that this is antiviral and anti-inflammatory. Exactly, of course, what we need. The letter urges the Indian government and all states in India to adopt ivermectin as a matter of urgency, as a frontline prophylaxis and treatment for COVID-19. So this is a preventative as well as a treatment. And if it's antiviral, this makes perfect sense. So if someone has a viral infection and you give an antiviral, you kill the viruses. You reduce the viral number. If the viruses aren't there, they're not being shed into the person's mucous membranes. That means when they cough, sneeze, cough, breathe, sing, shout, whatever it is, just normal breathing, the virus isn't expelled because the virus is dead. And dead viral particles won't infect anyone. Now, I know what you're saying, viruses aren't alive, but the viruses become alive when they enter the cell of the host because they replicate. But viruses become inactive. So if you prefer the term viral inactivation to viral death, so be it. But the viral numbers go down if you if you kill the viruses. So it makes sense that this would not only stop the individual getting sick, but stop the individual from spreading the disease by lowering viral load. And with prophylaxis, if there's some ivermectin on board, the viral infection would not get established to begin with, if the antivirals of ivermectin are what these groupings say they are, and they have presented, to my mind, convincing evidence of this. All India Institute of Medical Sciences and Indian Council for Medical Research have urgently responded with a recommendation to use ivermectin in mild outpatient illness. So this is what's happening now. We know this is happening. We talked to Dr. Pravin Nair on this channel probably about a week ago now, a consultant physician working in the Mumbai area, and he gives all his mild patients ivermectin, and he says it's very effective, and it prevents people from deteriorating onto severe illness. But here the ivermectin groups are saying it could go further and be a prophylactic, and could be used for more severe disease, and actually potentially for long COVID as well. But they don't mention that in this letter because it's an acute situation. We also recommend the use of ivermectin to be used as a COVID-19 prophylaxis. This is kind of what India needs to stop this tsunami spread. On a large scale throughout mass distribution of ivermectin in the dose of, and again, of course, we never prescribe on this channel. This is what they're recommending. I'm presenting it to you for educational purposes. Dose of 0.2 milligrams per kilogram. That's the lowest dose, but it's 12 milligrams. That's 12 milligram oral dose for a 60 kilogram person. And interestingly, they're now advising that weekly. Now, we did look at evidence from India for a significant prophylactic effect using ivermectin. I think it was 0.3 milligrams per kilogram, but that was only one dose. I think it was one dose at one day, then another dose at 3 days, and that was it for the month. Here they've changed their advice. They're talking about giving it weekly. So 0.2 milligrams per kilogram of body weight, 12 milligrams for a 60 kilogram person, weekly. Weekly to adults to decrease the transmission among the general population in the current crisis is what they are advising. We believe this will save thousands of lives and reduce the sufferings of millions. And as I say, we've had the pleasure of interviewing Tess Laurie and Pierre Corey on this channel. Now, this, in my view, demands an official response from governments around the world. What's the point in having brilliant doctors like Tess Laurie and Pierre Corey, and I'm sure this other doctor, I don't know the other doctor involved, but if we don't at least consider their advice. So that could be one way to stop this spread if this is accurate information. And as I've said, I'm personally convinced by the weight of evidence now that's been submitted, particularly the evidence that was submitted by Tess Laurie on this channel. But Dr. Corey has published another paper, which has been submitted. It is in a peer-reviewed journal now, so we are going to be considering that in a bit more detail. But we can only do so much in a day. Now, this is bad news. India, there's a lot of cases of mucormycosis. Mucormycosis. Now, mycosis means it's a fungal infection. So, mucormycosis. Now, we do see fungal infections occasionally, but not very often. We normally see them in immunocompromised patients. But this particular disease is caused by the mucor mold, typically 2 weeks after someone recovers from COVID. They can often develop a stuffy and a bleeding nose, swelling around about the eye, periorbital, round about the eye, and pain in the eye. The orbit is the hole in the skull where the eyeballs are located, so periorbital swelling, pain in the eye, drooping of the eyelids, blurred vision leading to eventual loss of vision, and sometimes a black discharge from the nose. So it's sometimes called black mold disease. And the thing about this disease is it blocks off the blood supply, causes necrosis of the tissues. Necrotic tissue means dead tissue. So in other words, parts of the patient start decomposing. And the only way to save the patient's life is to take out that dead tissue, requiring surgical procedures. And of course, many patients don't have access to surgery. So that makes the mortality overall about 50% generally, and without medical treatment, much higher than that. So why is this happening and how do we prevent it? Well, the mold likes to eat sugar. It's that simple. So patients that have high glucose in the blood, because the diabetes is badly controlled, high glucose in the blood, that will go into the tissue spaces and the fungi will simply, the mold will just eat it. So if you leave open a jar of jam, which is high in sugar, you'll find there's mold growing on the top of it because the mold likes the sugar. It's a very similar situation. So people with diabetes, if it's badly controlled, have hyperglycemia, high blood sugar levels. And the thing is, a lot of these patients need to go on steroids to reduce the inflammation. Now, this, of course, is correct. The evidence for the use of steroids appropriately, particularly in this second week of COVID-19, is there. That evidence is accepted everywhere in the world. This is universal global treatment. But steroids put your blood sugar up. So steroids cause hyperglycemia. So patients, particularly that were diabetic already, who were prone to high blood sugar. And in India, there's an absolute epidemic of under-recognised and undiagnosed diabetes in the population. Diabetes is very, very highly prevalent in India, type 2 diabetes especially. And then give steroids so your blood sugar goes sky high, lots of sugar in the tissue. The mole thinks, goody goody gumdrops, let's eat all this sugar. And you get the you get the infection. It's that simple. And the high glucose levels also interfere with the movement of the white cells. So normally the white cells will move through the tissues to get to the mold or the bacteria or the virus, whatever is causing the infection, to eat it. But when the blood sugar levels are high, that prevents the migration of the protective white blood cells as well. So not only have the mold got lots to eat, the white cells that normally kill the mold can't get there as the mold feasts, and the mold infection goes out of control and develops into life-threatening illness. Now, in the UK, we manage blood sugar control. So when someone is on steroids, for example, we will monitor their blood sugar levels. And this is routine in intensive care. We monitor blood sugar levels and we titrate the sugar down to the level we'd like it to be with intravenous insulin. Or at home you treat it with appropriate insulin. Or even oral hypoglycemic medications that bring sugar down. But if that's not done, sugar goes up. And there's been breakouts of this. And Dr. Nair did tell us about this last week as well, that he was seeing a lot of cases of this. And the cases he saw were reporting late and often required surgery. But of course, if there's lots of cases, there's only so many surgeons. And of course, surgery requires oxygen. You can't operate without oxygen safely. So it's just a bad situation. Treatment, antifungal intravenous injections cost $48 a dose, needed every day for up to 8 weeks. Work it out for yourself. In India, this is a fortune. Most poor people simply couldn't afford that. It would be out of the question. And the tissues that have already been infected with the mould, that are already infected, would need to be surgically removed. So it's a bit of a frightening disease, really. So the combination of the steroids given for the COVID and the glucose has caused a bit of an outbreak of this in India. I've never... I think I remember seeing this once in the mid-80s. In a patient who was HIV positive, or HTLV3 positive as we called it in those days. This was in the bad old days of the AIDS pandemic, before we had the antiretroviral drugs, where we saw really quite unpleasant disease in people, including these unusual infections, because of the immunocompromise. And now, of course, we're seeing it again because the steroids cause immunocompromise. They're necessary, but they cause immunocompromise. They put the sugar up, and the diabetes puts the sugar up as well. So this doctor's saying the strain of the virus appears to be virulent, sending blood sugars soaring to very high levels. So this is one of the doctors on the ground saying the virus. So again, when someone has an infection, that puts your sugar up as well. So, I mean, hyperglycemia is one of the sepsis criteria. If you have a severe infection, that puts your blood sugar levels up. And strangely, the fungus infection is affecting a lot of younger people. So, one to watch, not good news, just another complication of the pandemic in India. All the more important to prevent the infection in the first place, if possible. Now, Nepal, just over the border, also not good. So, here's the Nepal graph here. And we see a rapid increase in cases, very rapid increase in cases in Nepal. Rapid increase also. Now, Kathmandu airport is closed. You can't go in or out via air anyway. Migrant workers are returning from India, so that's a bad factor. A lot of them are carrying the infection with them. And there were cases increased first in the border towns, so that happened as well. But it was already circulating in the Kathmandu Valley, unfortunately, so that was already there. So the valley remained a bit of an epicenter. It didn't quite go away. Then the government announced restrictions, so 500,000 workers left the Kathmandu area to go back to their villages. So they went from a high prevalence area to their villages all over Nepal, because if you're not working every day in Kathmandu, you can't make a living. At least in your village, you can catch one fish, you can grow some you can forage for a few bits of food. In the city, without money, it's very, very difficult. So 500,000 people left on the same day, and spread the infection all over Nepal. So workers coming back from India, workers leaving the Kathmandu area. Prime Minister apparently has been on TV advocating herbal cures, which we don't advocate on this channel. Absolutely not. We only advocate things that there is evidence for individuals, doctors to consider. So there's been political rallies, religious festivals, huge weddings. 57 times more cases than last month. Patients are being treated outside hospitals, and many patients, again, can't get into hospitals. So unfortunately, we're seeing a replication of the India situation in Nepal. And again, poor country, can't cope with this, doesn't need it. It's just very bad news. India, a couple of cases have arrived. India COVID variant, a couple of cases have arrived in the Philippines, returning workers from the United Arab Emirates and Oman. So that, to me, says that there are cases in United Arab Emirates and Oman already of the India variant. Now, the two in the Philippines are quarantined. But of course, if you think about the population density in somewhere like Manila, I don't know what the population of Manila is. Is it 20 million or something like that? Very densely populated slum areas in many areas. If that Indian highly transmissible variant took root there, then unfortunately the India situation potentially could be replicated in the Philippines. This is why we were so concerned about this variant on this channel for the last month. And anyway, we've been through that bit already. Now, likewise in Africa, Nigeria, it seems to be mostly the South Africa variant, but population 200 million. Vaccine deliveries down. Why are vaccine deliveries down? Because most of their vaccines were coming from this, what's it called, that United Nations, the COVAX program. But of course, most of those vaccines were coming from the Serum Institute in India, in Pune. And the Indians, of course, are keeping their own vaccines now. So the delivery of vaccines to African countries is massively down. Because understandably, the Indians are desperate to vaccinate their own population. So for 200 million people in Nigeria, 4 million doses have arrived so far. Now, Johnson & Johnson are due to supply quite large numbers, we believe at very reasonable prices, later this year, but not yet. But it's going to take 2 or 3 years to vaccinate, the way things are going, 2 or 3 years to vaccinate the population of Nigeria. Lots of problems in Nigeria, of course. Corruption is completely endemic. Many poor people don't have access to healthcare at the best of times, and apparently the compliance has been very poor lately. Government's reimposed some strict lockdown measures, haven't bothered putting a graph on because we know that the numbers aren't accurately reported and there's essentially no genomic testing in Nigeria. And Kenya is another country of concern. So unfortunately, it's not good news. Cases are going to carry on increasing in India for another week or two, and deaths most certainly are. And let's hope there is some official consideration of what we've talked about in this video, because it is not good. It's not a good situation. Okay, thank you for watching this video.